Welcome back to Dr. Welling Insights, the channel where we transform complex medical information into practical, understandable guidance that can literally save your life. I'm Dr. Welling, and today we're exploring one of the most critical health topics you need to understand: the warning signs that appear before a major stroke occurs. Every single day, thousands of people around the world experience a stroke, and what many of them don't realize is that their body was trying to warn them something was dangerously wrong. The human body is remarkably good at sending distress signals, but we often miss them because we don't know what to look for. By the end of this video, you'll understand exactly what these warning signals look like, what's happening inside your body when they occur, and most importantly, what you should do if you experience them. This knowledge could mean the difference between a full recovery and permanent disability, or even between life and death. Let me start by helping you understand the fundamentals of what a stroke actually is and why your body sends warning signals before it happens. A stroke occurs when blood flow to a portion of your brain becomes severely restricted or completely blocked. This is a critical situation because your brain is the most metabolically active organ in your entire body. Although your brain comprises only about 2% of your total body weight, it consumes approximately 20% of all the oxygen you breathe in with every breath and roughly 25% of all the glucose circulating throughout your bloodstream. Your brain never rests. It's working 24 hours a day, 7 days a week, without any breaks. It's processing sensory information, controlling all of your voluntary movements, regulating your heart rate and breathing, maintaining your body temperature, processing emotions, forming memories, and countless other vital functions. Because your brain is working so intensely all the time, it requires a constant, uninterrupted supply of oxygen and glucose. When that blood supply becomes compromised, even for a very short period, the brain cells in the affected area begin to suffer. After just a few minutes without adequate oxygen, brain cells start to die. The longer the blockage persists, the more extensive the permanent brain damage becomes. This is precisely why medical professionals describe stroke as a race against time. Every single minute that passes without restoring blood flow means more irreversible damage to your brain tissue. Here's something that many people find surprising. In a significant number of cases, a major stroke doesn't happen completely unexpectedly. The groundwork for a stroke is typically laid over months or even years of silent vessel deterioration. Gradually, cholesterol and fatty substances called plaques begin to accumulate on the inner walls of your arteries. This process is called atherosclerosis, and it's incredibly common in modern societies. The inner lining of your arteries, called the endothelium, becomes damaged. Blood vessel walls lose their elasticity and flexibility. The opening through which blood can flow becomes progressively narrower. All of this can happen without you feeling anything at all. Many people walk around with significant vessel damage without any awareness of it. However, before a major stroke occurs, your body often sends out preliminary warning signals. These come in the form of something doctors call a transient ischemic attack, commonly referred to as a TIA. A TIA is essentially a temporary stroke. It's a temporary interruption in blood flow to the brain that produces stroke-like symptoms, but these symptoms resolve completely within minutes or sometimes within a few hours. The symptoms completely disappear and the person feels fine again. But here's the absolutely critical thing you must understand. A TIA is not a minor event that you can safely ignore. Research and clinical experience have shown very clearly that someone who experiences a TIA has a significantly elevated risk of suffering a major stroke very soon afterward. Statistically, someone who's had a TIA is at highest risk during the 72 hours following the episode. That means you have approximately 3 days to seek medical attention and get evaluated. That 3-day window is your opportunity to prevent a potentially catastrophic stroke through proper medical evaluation and treatment. Now let me walk you through 7 specific warning signs that can appear in the 24 hours preceding a major stroke. These are symptoms that should never be dismissed or attributed to other causes without getting a proper medical evaluation. Understanding these signs is absolutely essential because recognizing them could save your life or the life of someone you love. The first warning sign is temporary vision loss that affects just one eye. Picture this scenario. You're going about your normal day, perhaps working at your desk or doing household chores, and suddenly one of your eyes goes dark or becomes very foggy. It's as if someone has pulled a dark curtain across your vision from the top down, or as if someone has smeared the lens of your eye with gray or translucent material. You might see complete darkness, or you might see grayness or blurriness, but the key point is that it affects only one eye. If you cover one eye, you can see normally through the other. This episode lasts anywhere from a few seconds up to several minutes, and then your vision returns to normal completely. You might initially think you stood up too quickly and experienced a momentary dizzy spell, or perhaps you spent too much time looking at a computer screen and your eyes are tired, or maybe you rubbed your eyes too hard. But what's actually happening inside your body is significant and concerning. That temporary blindness is almost certainly caused by a tiny blood clot or a small fragment of fatty plaque that has broken loose from the wall of your carotid artery. The carotid arteries are the major arteries in your neck that carry blood directly from your heart up to your brain. This fragment has dislodged and traveled upward through the bloodstream. It is lodged in the artery that supplies blood to your eye, causing a temporary blockage. The retina, which is the light-sensitive tissue at the back of your eye, suddenly loses its blood supply. Without oxygen, it cannot function properly, and so you lose vision in that eye. When the clot or plaque fragment moves on its own and drifts away from where it was stuck, blood flow returns to the eye. Your retina gets oxygen again, and your vision comes back completely. You feel fortunate and relieved, and you put the incident out of your mind. But here's what makes this warning sign so important and why it should never be ignored. That same blood clot could have lodged in an artery within your brain instead of in the artery to your eye. If it had done so, instead of experiencing 1 minute of vision loss in one eye, you could be facing permanent loss of speech, complete paralysis of one side of your body, loss of sensation, cognitive problems, or even death. Medical professionals have a specific Latin name for this temporary one-eye blindness: amaurosis fugax, which literally translates to fleeting blindness. Neurologists treat this symptom as a serious medical emergency. When patients come to a neurologist reporting that they've experienced one-eye blindness that came and went, they receive urgent evaluation and testing. This is because the risk of experiencing a major stroke in the hours immediately following a TIA episode is genuinely and significantly high. If you look at hospital records and follow-up data, you'll see a consistent pattern. Patients experience 2 or 3 episodes of temporary vision loss in one eye, and then the next episode is not in the eye, but in the brain itself, resulting in a full, major stroke. The second warning sign is sudden numbness or tingling that appears on one side of your body. This sensation can affect your entire arm, just your hand, half of your face, your entire leg, or even one entire side of your entire body from head to toe. The sensation might feel like tiny pins and needles, like your skin is made of cotton or thick fabric, or like the affected body part has turned to rubber and lost all normal sensation. The critical aspect of this warning sign is that the sensation appears suddenly, without any obvious cause, while you're simply sitting down, walking, or having a conversation with someone. You weren't doing anything that would normally compress a nerve or cause numbness. The numbness or tingling lasts for a few minutes and then disappears completely on its own. You might be tempted to compare this to the experience of sleeping on your arm in an awkward position during the night. When you sleep on your arm, you're compressing the nerve that runs through that arm, restricting blood flow and nerve signal transmission. That's why you wake up with your arm feeling numb and tingly. But as soon as you move your arm and change position, blood flow returns and the nerve signals resume, and the sensation comes back within 1 or 2 minutes. That's a completely different mechanism from what happens with a TIA. With a TIA, the problem isn't in your arm, your hand, or your leg. The problem is in the specific area of your brain that processes sensory information from that arm or body part. When blood flow to that particular brain region becomes temporarily blocked, the brain cells there don't get the oxygen they need to function. They can't process the sensory signals coming from your limb, so your brain interprets that as the limb being numb or tingly, even though there's nothing physically wrong with the limb itself. One very important detail: stroke symptoms are typically one-sided because each hemisphere of your brain controls and receives sensory input from the opposite side of your body. Your left brain hemisphere controls the right side of your body, and your right brain hemisphere controls the left side of your body. This is why if you experience numbness or tingling that affects only one side of your body, it's a much stronger indicator of a neurological problem like a TIA. However, if both of your hands go numb equally at the same time, or both feet, that's more likely to indicate a spine problem or a nerve problem in your limbs rather than a stroke. But if you suddenly experience numbness or tingling that affects one side of your body and it goes away after a few minutes, that's a strong indication that you should get checked for a TIA and be evaluated for stroke risk. The third warning sign is a sudden loss of balance and coordination, often described by patients as feeling drunk, without having consumed any alcohol. Imagine you're standing on a perfectly flat, familiar surface that you walk on every day without any problems. Suddenly, without any warning, your foot lands in the wrong place, as if your body has completely lost its sense of where it is in space. Your leg might feel weak or unusually rubbery, not like tired muscles, but like the muscle control isn't working right. You might find yourself staggering into a wall or suddenly grabbing onto a door frame to steady yourself, even though you didn't trip, you didn't jerk your head, and you didn't just stand up from lying down. Alternatively, you might experience a sudden, intensely strong sensation of spinning or vertigo that makes you grab for something solid to hold on to, even though you're not actually spinning and nothing external caused the sensation. This sensation can be quite frightening because it feels like the room is spinning around you violently. What's happening in these cases involves a part of your brain called the cerebellum. Most people don't think about the cerebellum very often, but it's absolutely essential for maintaining balance and coordinating smooth movement throughout your body. The cerebellum is located deep in the back of your skull, nestled below the larger cerebrum, and it essentially functions like a second brain, dedicated entirely to movement and balance. It constantly calculates where your body is positioned in space, what angle your head is at, what your limbs are doing, and how hard each individual muscle should contract, so that you can walk in a straight line instead of zigzagging, so that you can pick up a glass of water without spilling it all over yourself, so that you can maintain your balance while standing on one leg, and so that you can coordinate complex movements. The cerebellum receives its blood supply from specific arteries that run upward through the bones of your neck and into the back of your head. Medical professionals refer to this network of blood vessels as the vertebro-basilar system. If blood flow through these arteries drops sharply, even for just a few seconds, the cerebellum essentially has a glitch. It stops receiving the oxygen it desperately needs to function properly. Suddenly, you feel like you're losing your balance, and your coordination becomes impaired. This is when you might veer to one side when trying to walk straight, misstep on a perfectly flat and familiar surface, or experience vertigo for absolutely no obvious reason. In clinical practice, there's a very common and unfortunate pattern where people experience these episodes and write them off as caused by wearing bad shoes, or simply feeling tired that day, or having low blood pressure, only to discover later, sometimes after suffering a major stroke, that those episodes were actually cerebellar transient ischemic attacks. Benign dizziness and balance problems usually have a clear trigger that you can identify. Rolling over in bed causes it, turning your head quickly causes it, or you know you have an inner ear condition like benign paroxysmal positional vertigo. But if you experience spontaneous, intense dizziness or vertigo that comes out of nowhere and is accompanied by any trouble walking in a straight line or maintaining your balance, that should be treated as a possible TIA and investigated by a medical doctor to rule out a vascular cause. The fourth warning sign appears in your speech patterns and language. Before I explain what constitutes a warning sign, I want to be very clear about something important. If you occasionally can't remember your neighbor's name, or you temporarily forget the word for something common like a toothbrush or a doorknob, that's not a stroke warning sign. That's a completely normal tip of the tongue moment that happens to virtually everyone, especially when you're tired, stressed, or trying to remember something under pressure. What actually worries neurologists, and what you should take very seriously, is something quite different from occasional forgetfulness. You experience a sudden and dramatic breakdown in your ability to speak or understand language, so severe that even you realize something is seriously and dangerously wrong. There are two main speech areas in most people's brains, and they're usually located in the left hemisphere, though in some left-handed people, the situation can be reversed. One region, often called Broca's area, is responsible for helping you form words and send clear instructions to all the tiny muscles in your tongue, lips, jaw, and throat. When this region suddenly loses blood flow due to a temporary blockage, you might understand everything that people say to you perfectly. You might have your thoughts completely organized in your mind. You know exactly what you want to say in response to someone's question, but you simply cannot get the words out of your mouth. Your words come out severely slurred, chopped up into pieces, or they get stuck and won't come out at all. It's as if the connection between your brain's language center and your mouth has been abruptly severed or disconnected. The other major speech area, often called Wernicke's area, is responsible for helping you understand what other people say to you and for helping organize your own sentences so they make sense and flow logically. When blood flow to this area is temporarily interrupted, a person may speak very fluently and smoothly. Their words come out easily, but the words they're saying don't make any sense. It's called word salad, where the individual words themselves might be real words from the dictionary, but they're arranged in a way that's complete nonsense, like purple sidewalk banana telephone. Additionally, a person experiencing Wernicke's aphasia may not understand simple sentences directed at them. If someone says, "Please sit down," the person doesn't understand what's being asked. If someone says, "Do you want water?" they don't comprehend the question. If any of these speech problems appear suddenly and then fade away after a few minutes, that's absolutely classic for a TIA. It's not something you can safely dismiss or ignore just because it's self-corrected. That's equivalent to your home security alarm going off loudly, then stopping by itself, and you deciding it was probably nothing and not checking what triggered it. That alarm was telling you something needed immediate attention, and the same applies to sudden speech problems. The fifth warning sign is facial drooping or weakness on one side of your face. You might be looking in a mirror, or perhaps someone close to you points it out, and you notice that one side of your face appears drooped or is asymmetrical compared to the other side. Your smile might look uneven, with one corner of your mouth being pulled downward while the other side appears normal. One eyelid might appear slightly lower than the other, giving your face an unbalanced appearance. Your cheek on one side might look flatter than the other side, or the skin might sag differently. You might notice that when you try to raise your eyebrow, one eyebrow doesn't move as much as the other. These changes are caused by temporary disruption in blood flow to the part of your brain that controls the muscles of facial expression. The facial muscles are incredibly important for how we communicate our emotions and thoughts to other people. When you have a TIA affecting this brain region, you might notice difficulty raising your eyebrow evenly on both sides or difficulty smiling in a balanced way. The episode lasts a few minutes and then resolves completely, but it's telling you that the blood supply to your brain has been interrupted. Medical professionals use the acronym FACE to help people remember the major stroke symptoms. F stands for facial drooping, A stands for arm weakness, C stands for speech difficulty, and E stands for emergency time. If you notice facial drooping, especially on one side of your face, and it's accompanied by any other symptoms we've discussed, this is definitely a reason to seek medical evaluation urgently. The sixth warning sign is sudden severe headache that's completely unlike anything you've experienced before. This is not a normal headache, and it's not even a migraine if you're someone who gets migraines regularly. This is a sudden, explosive headache that feels fundamentally different from your usual pain patterns. It might be the most intense headache you've ever experienced in your entire life. The headache might be accompanied by a stiff neck, confusion, or sensitivity to light where bright light causes you pain. You might describe it as the worst headache of your life. This type of headache can indicate a hemorrhagic stroke, where a blood vessel in the brain has ruptured and is actively bleeding. This is a true medical emergency requiring immediate hospital evaluation and treatment. Any sudden severe headache that's unusual for you and differs from your normal headache patterns warrants urgent medical attention. You should not wait and see if it goes away on its own. You should call emergency services or have someone take you to the nearest emergency room immediately. The seventh warning sign is sudden confusion or difficulty understanding things around you. You might find that when people talk to you, their words aren't making sense. The words are coming to your ears, but your brain isn't processing them properly. You feel disoriented about time or place. You might not know what day it is or where you are. Your thoughts feel jumbled and unclear. Your thinking feels foggy. You might ask the same question repeatedly without remembering that you just asked it a few moments ago. You might struggle to focus on what someone is saying to you, even though they're speaking clearly. This confusion lasts a few minutes and then clears up, but it indicates that blood flow to the areas of your brain responsible for processing information and understanding language and context has been temporarily disrupted. Now that you understand these 7 warning signs, let me explain what you should actually do if you experience any of them. This is the action plan that could save your life. First and most important, do not ignore these symptoms or try to rationalize them away. The natural human tendency when something strange happens and then goes away is to assume it wasn't serious or that you imagined it. That tendency can be deadly. Resist it. Even if symptoms disappear completely, you still need medical evaluation. Second, do not drive yourself to the hospital or anywhere else after experiencing these symptoms. If you've had even a brief episode of vision loss, weakness, numbness, balance problems, speech difficulties, or confusion, your safety and the safety of others around you is at significant risk. Your brain might not be getting adequate blood flow, and you might experience another, more severe episode while you're behind the wheel of a car. That could result in a serious accident that harms you and others. Third, call emergency services immediately or have someone take you to an emergency room for evaluation. Tell the medical team that you've experienced symptoms that concern you might be a TIA or stroke. This information is important because it will prompt more rapid and urgent evaluation. Fourth, try to note the exact time your symptoms started. as this information helps doctors determine what treatments might be most appropriate and effective. There's a critical window where certain emergency treatments can prevent a stroke from developing. Fifth, avoid taking aspirin or other blood-thinning medications on your own based on something you read or something a friend suggested. This is critically important because there are two different types of stroke. Ischemic strokes are caused by blood clots blocking an artery. Hemorrhagic strokes are caused by bleeding in the brain. Blood-thinning medications help with ischemic strokes, but can make hemorrhagic strokes much worse and more dangerous. Only proper brain imaging at a hospital can determine which type of stroke is occurring, so you need medical professionals to make this determination. If you have experienced any of these warning signs in the past, even months or years ago, you should bring this to your doctor's attention during your next visit. Your doctor might recommend specific tests to evaluate your stroke risk. One important test is a carotid ultrasound, which uses sound waves to create images of your neck arteries and assess whether they're narrowed by plaque buildup. Another useful test is a blood test called hemoglobin A1C, which measures your average blood sugar over the past 3 months and can identify prediabetes or diabetes, both of which significantly increase stroke risk. Your doctor might also recommend Holter monitoring or event monitoring to check for irregular heart rhythms like atrial fibrillation, which substantially increases stroke risk because it allows blood clots to form in the heart. Prevention is always better than treatment when it comes to stroke. You can reduce your stroke risk through multiple lifestyle modifications. Manage your blood pressure in consultation with your doctor, aiming for healthy targets. Control your blood sugar by eating a balanced diet and maintaining a healthy weight. Avoid smoking completely, as smoking dramatically increases stroke risk. Maintain a healthy diet rich in vegetables, fruits, whole grains, and lean proteins, while limiting processed foods and excess sodium. Exercise regularly, aiming for at least 150 minutes of moderate exercise per week. Manage your stress through meditation, yoga, or other relaxation techniques. Maintain a healthy weight, as obesity increases stroke risk. These lifestyle factors are foundational to stroke prevention. The information in this video is educational and is meant to help you understand your health better and recognize important warning signs. Everyone's medical situation is unique to their circumstances. You should always consult with your own healthcare provider about your individual circumstances, your specific risk factors, your family history, and what specific preventive measures or evaluations make sense for you personally. Your doctor knows your complete medical history and can provide personalized recommendations. If you found this information helpful and potentially life-saving, please subscribe to Dr. Welling Insights and share this video with people you care about. These warning signs literally save lives when people know about them and act on them appropriately. Thank you for watching, and I hope this information helps you live a healthier, longer life.